expanding Medicaid.
For years,
Expanding Medicaid.
Governor Roy Cooper has pushed the same agenda item.
A way where we can get 500,000 to 600,000 more North Carolinians some health insurance.
This evening, there's a new compromise which might get Republican leaders to sign off also. The deal has one political science professor saying,
I'm surprised, but the more I think about it, the less surprised I am, maybe.
Let's dig into it. After almost a decade of debate, healthcare advocates say we are on the verge of a major compromise between Republicans and Democrats to expand Medicaid in North Carolina. A new bill's in the works. This time around at the General Assembly, they say it would be bipartisan in support. So how does that impact you, and what changed to get us to this point? I'm Ben Briscoe. We're going to dig into it now through 6 o'clock. To really understand what's different this time around, let's start back in March of 2021. President Joe Biden signed a bill to send more federal money to the 12 states which haven't expanded Medicaid yet, including North Carolina. It's enough to cover the cost of all the people added to the plan for 2 years. While a big pot of money might seem like a win-win for North Carolina, Republicans were worried that eventually the federal government might stop sending that money, leaving the state taxpayers stuck with the bill. But in November of last year, Senate Leader Phil Berger said he was open to expansion if they could iron out the sticking point. So in February, the General Assembly launched a new joint legislative committee to study Medicaid expansion and how to pay for it in the long run. This new bill being considered has come out of their work on the issue. Which brings us to today. Governor Cooper was touring a school in Winston-Salem. While he was in the Triad, we asked what he thought about the possibility of expanding Medicaid. He has pushed for it often since taking office in 2017.
Almost 25% of our early childhood educators cannot afford health insurance. This is the kind of person that will be helped out by Medicaid expansion. Senate Republicans see this is something that we need to do, and I hope that we can bring everybody together in a bipartisan effort to draw down these federal funds to get more people insured. It's the right thing to do.
A spokesperson for Senate President Phil Berger's office says Senate Republicans continue to have discussions about how to address the rising cost of health care and how to increase access in the state. UNCG political science professor Tom Little adds a whole lot has changed since way back when Republicans first opposed Medicaid expansion. That was starting way back in 2014. He says our budget looks much better now, for one thing.
I think Senator Berger is accurate when he says they now believe that the 90% that the feds are going to fund is going to be pretty consistent, because that was one of their concerns. Is we start this and then they start taking that 90% down to 80, then to 20, then to 70, and so that was one. But the other thing is you got to look at the budget surplus in the state. You've got a huge pot of money that you didn't have. We've got a huge budget surplus.
Not everyone thinks expanding Medicaid is a good idea. Jordan Roberts works for the conservative John Locke Foundation. He says it's unfortunate so many people don't have coverage, but he does not support expanding the program.
We believe Medicaid needs to stay for the populations that it was originally designed for.
He says adding more people to Medicaid coverage is, quote, bad policy and doesn't address rising health care costs. Medicaid is a federal and state program that provides health insurance to low-income Americans. States receive money from the federal government to actually run the program. Medicaid also provides coverage to children, pregnant women, elderly adults, and people with disabilities. The program is designed for folks not making a whole ton of money. According to a Georgetown analysis, currently, parents with incomes up to 41% of the federal poverty line are eligible for Medicaid in North Carolina. A single parent of one would have to make less than $7,500 a year under those guidelines. A study from the National Bureau of Economic Research says in states that expand Medicaid, the move has saved at least 19,000 lives. On the flip side of that, states that did not expand Medicaid saw more than 15,000 people die prematurely. That includes about 1,400 right here in North Carolina. The group Healthcare NC wants to stress that's not just a statistic. We are talking about real people, like Deanna. A while back, she testified to state lawmakers. Deanna was in between jobs, but qualified for Medicaid because she was pregnant. Then things took a tragic turn.
He was stillborn. By me not having him anymore, I lost my coverage.
By the time she was able to find a steady job and insurance, she went back to the doctor who discovered she had stage 4 cancer. Despite 8 months of chemo, Deanna passed away. Healthcare advocate Laura Packard with Healthcare Voters say expanding Medicaid can help keep people alive.
Having access to health care through Medicaid means that you can see a doctor when you have any kind of symptom. If you have any kind of chronic illness, that means you'll be able to get the care and the treatments that you need to stay healthy. I'm a stage 4 cancer survivor, and the insurance I had through the Affordable Care Act saved my life. But how many North Carolinians are not here today to tell their stories?
Some insiders in Raleigh think Medicaid could get expanded because of a bill summary. It's not filed in the House or Senate yet. It's just a proposal at this point. The proposal, called NC Health Works, would cover adults with incomes up to 138% of the federal poverty guidelines. For a one-person household, that's about $19,000 a year. That likely gives at least 600,000 people coverage in our state. But the expansion would end if the federal government stopped funding the program at that promised 90% of expansion cost. The summary says the other 10% of the expansion would get paid through a new assessment on hospitals. States like North Carolina have discussed Medicaid expansion for a long time. The Affordable Care Act allowed for states to opt in or out. This map from the Kaiser Family Foundation shows who's in, who's out. North Carolina is one of 12 states who have not yet expanded Medicaid. A report from the American Medical Association found in states that did expand Medicaid, there was a 41% increase in preventative care visits and a 5% decrease in trips to the ER as primary care. The bottom line is this: Medicaid expansion could mark a huge step for our state. Lawmakers have debated it for years and years, but they might finally have a compromise. There are still a ton of procedural steps, though, to get through first. You can trust us to stay on top of this each and every update.